Well, hey, thanks for joining us. I'm Dan Hurry, president of Advantus Health Partners, and I'm joined here by John Wright, the chief operating officer of Advantus Health Partners, and we're happy to discuss what we think is critically important to any healthcare system, and that's purchase services.
Yeah, purchase services is really the largest non-labor expense category most health systems have. So it's very impactful to the bottom line. But it's often the category that receives the least amount of attention in terms of expense management, oftentimes because it's really not even well understood what a hospital might be spending in their purchase services, whether they're clinical purchase services or non-clinical purchase services. And that's why we have really made it an effort within Advantus Health Partners to put a laser focus on not only insight of what that expense looks like, but then how do we really deliver value to our members in that purchase services category by picking very strategic partners and focusing on value creation.
How impactful is a health system's purchase services spend on their bottom line?
Absolutely. So if you just look within the non-labor expense category, you generally have supplies expense, you have pharmaceutical expense, and purchase services. And purchase services is the largest of those three categories in most health systems. Generally accounts for 40% of their spend in that non-labor category. So anything you can do to affect a dollar of expense reduction in that category really drops straight down to the bottom line for the organization. And I think that it's important that the way we go about tackling that expense is to bring awareness to it and really understanding what the problem is, right? Is there an issue with quality of service that's being provided, whether it's an in-house operation or an outsourced operation? Is it the expense management side that really is the driver that the health system is seeking improvement in, or frankly, a combination of quality and cost? And I think that's the way we want at AHP to select partners who understand and can deliver value across both those dynamics, right? Not just improving the cost position of the organization, but focusing on ideally improving the quality of service that the health system receives.